Welcome to Breakfast Bites. We are very happy to have with us today Katie Rydberg, who is a program manager for the University of Minnesota Rural Health Research Center, where she manages the operations and development of the UMN's rural health programs. She also contributes to a variety of federally funded research projects focused on social drivers of health in rural areas, access to care, and mental health. Today, she will talk to us about three initiatives, principally three initiatives, but also the broad range of work that she does and the university does in rural health. Anyway, good morning, Katie. It's good to see you today.
Thanks, Guillermo. Let me just get my slides pulled back up here, and I can go ahead and get started. Can you see my slides okay? Perfect. All right. Well, again, thank you so much for having me. My name is Katie Rydberg, and I'm the program manager for the University of Minnesota Rural Health Program. I'm really excited to share a little about what the Rural Health Program does and how you can get involved in our initiatives. So the Rural Health Program was developed in 2020 and is funded by the Clinical and Translational Sciences Institute and Office of Academic and Clinical Affairs here at the University of Minnesota. And our mission is to improve the lives of rural residents and families, advance population health, and enhance the vitality of rural communities. And so this collaborative effort provides training and support for public health challenges in rural Minnesota and connects local experts with national research and policy work. So share a little bit about our leadership team. The co-directors of the Rural Health Program are my amazing, fantastic colleagues, Dr. Katie Bacchus-Casamano and Dr. Carrie Henning-Smith. And like I mentioned, I am the program manager for the Rural Health Program, and I've been in my role since shortly after the program was developed in 2020. And so the Rural Health Program has three core initiatives, which I'll be sharing about today. So first, our Rural Health Policy Post-doctoral Program, the Rural Collective, and Project Reach, which is our community-based program. And so first off, I'll share a little bit about our Rural Health Policy Postdoc Program. So the goal of our Rural Health Policy Postdoctoral Program is to train scholars who will become innovative research leaders in rural health. And this opportunity is open to scholars from a wide range of backgrounds who maybe have specific rural research interests, or those who have skills that translate well into rural research. And this is a 2-year program. In the first year of the program, our postdoc co-leads a research project at the Rural Health Research Center. And that research is typically very national in scope. And then in the second year, our postdocs complete an independent project that focuses on rural Minnesota. And so our postdocs receive mentorship from either Katie Casamano or Carrie Henning-Smith, and they also receive support from other rural health experts here at the University of Minnesota, and they can also take part in other professional development opportunities here at the U throughout their 2 years in the program. And so I'll share here a list of our amazing former and current Rural Health Policy Postdoctoral Associates, Dr. Bridget Basili Ibrahim, Dr. Hannah McDougall, Dr. Alexis Swendener, Dr. Clara Bussey, and Dr. Anna Shetler. And they've all come to us from different backgrounds like nursing, social work, sociology, epidemiology, demography, and have various personal and professional experiences in rural communities across the country, which is really cool. And so they have and continue to do amazing rural health policy research related to rural maternity care, aging and elder care in rural areas, rural housing, the impacts of medical debt in rural communities, and access to mental health services in rural areas. I wish I had time to share in depth about the work of each of them, but I'll briefly highlight the work of one of our current postdocs, Dr. Clara Bussey, she's currently in her second year of the program. And so Clara has a background in epidemiology and maternity care research. And so she had been following some CDC reports related to maternal syphilis cases and realized that the national data wasn't broken down into rural and urban differences, which is a big oversight actually in the data, considering, the rural urban differences in healthcare availability. And so she was able to conduct a study that looked into these geographic differences and found that between 2016 and 2023, rates of syphilis during pregnancy quintupled in rural areas and tripled in urban areas. And these disparities were especially alarming amongst rural American Indian and Alaska Native communities, where rates of syphilis during pregnancy increased more than 1,000%. And so she had the study published a few months ago in a leading obstetrics and gynecology journal. And she also recently wrote an op-ed in MinnPost about the rising rates of maternal syphilis in rural Minnesota and the implications for rural families here in Minnesota, as well as across the country. So that's just kind of an overview of how our postdocs are being really innovative in rural health policy research. And so I'll do a brief plug here. If this postdoctoral program sounds interesting to you or someone you know, I'm really excited to share that in the next few weeks, we are going to start hiring for our next postdoctoral associate, which is really cool. This job posting should be live in early December. I think the first week of December is what we're aiming for, with an application deadline of Friday, March 13th in 2026. And that postdoc would be starting with us typically end of August, beginning of September. So like I said, if you're interested or know people who would be interested in this opportunity, please keep an eye out for that job posting that should be coming out here soon. So next here, I'm going to talk about the Rural Collective. So the Rural Collective is a forum for networking and collaboration for any University of Minnesota faculty and staff from all campuses and the extension who do rural work or have any rural interests. All disciplines and departments are welcome. I do need to put a new map on here that reflects the new medical school campus in St. Cloud that's focusing on rural medicine, which is exciting. But the purpose of the Rural Collective is to really bring awareness of the rural work that's happening across the university system, because oftentimes we're so siloed in our campuses, in our departments, and it can be really hard to know what's happening in other parts of the university system, and especially this work that's really benefiting rural communities. And so, like I said, while this group is very much targeted towards faculty and staff specifically, we are starting to open up membership a little bit to PhD students who are currently working on their dissertations and whose dissertations research question has a rural focus, is very rural focused, and the research question is rural focused. And so the Rural Collective has 2 virtual meetings per year, one in the fall semester and one in the spring semester. At our virtual meetings, we highlight the different members' research or work. We've also had guest speakers like the Board of Regents member, Regent Doug Hipsch, who is from rural Minnesota, to talk about what's like to represent rural Minnesota as a Board of Regents member for the university. We also have typically 2 in-person events per year, and we very much purposely hold those away from the Twin Cities campus. We've had events up at Crookston, Morris, the Duluth campus, as well as other University of Minnesota research locations like the Hormel Institute in Austin, the Cloquet Forestry Center, the Itasca Biological Station, and the Mid-Central Research and Outreach Center in Wilmer. And so these in-person events are a really great opportunity to do networking. And we also typically have someone from our host site share about the work that they're doing in rural Minnesota. We also love to invite local extension offices in the regions wherever we have our events to share about the work that they're doing in the region as well. So just a really great networking and learning opportunity for our in-person events. We do also have a membership directory on our website that you can see who's involved in the collective. It lists people's names, roles, departments, emails, any research center affiliations, and research interests. So this is a really wonderful resource where we can often point people to who are looking for subject matter experts on certain topics, or if they're looking for, for a contact at the university who maybe works in a certain region of Minnesota. And it's really a great starting place to see kind of the scope of the rural work and the rural interests that are available at the University of Minnesota system. And so another great benefit of the collective is that we have mechanisms for sharing updates and opportunities for members. And so if there are any rural relevant opportunities and resources that may be of interest to rural collective members, like upcoming trainings, webinars, publications, job postings, funding opportunities, members will email them to me, and then I share them out to our member email list, typically on a weekly basis. I do try not to bombard people's emails, but it's been a really useful way to keep people aware of opportunities of interest, so people can share them, with others across the university system and other people in their rural networks who may be interested as well. And so as you can see here, we have currently, as of this month, 186 members and also 38 research centers affiliated with the collective. And as you can see, most of the members are faculty and staff from the Twin Cities campus who have rural interests or do rural research. But we also have quite a few members from the Duluth campus, an increasingly growing number of members from the extension, with a handful of people from Crookston, Morris, and Rochester. And now, like I said, with the new St. Cloud campus, we're slowly starting to get some membership from there as well. And so I'll quick share what the Rural Collective has been up to in recent months and share some upcoming opportunities. Our virtual meeting this fall featured SEARCH, which stands for Community Engagement to Advance Research and Community Health, and that's another CTSI program. And one of their leaders, Dr. Michelle Allen, shared about the resources and opportunities that they provide that can be helpful for those doing community-based participatory research in rural communities. We also had our most recent in-person event this September at the Itasca Biological Station, which if you have never been there before, I highly recommend you to find an excuse to hold an event up there, because it is absolutely gorgeous and it is just such a special place to visit and a great place to hold an event. One of the station scientists gave an overview of the research that's being done at the station. And we also had some extension staff from the region, from some of the local county offices in the area to share about their work. And we also had some alumni from the Project Reach program, which I'll be sharing about a little bit momentarily, who are located in northern Minnesota, to share about their policy work in the program and how that's continued in recent years. And so just a lot of great networking and discussion, and it was really fun. And you can see our lovely group photo of people who attended that event here. Coming up in the spring, we have a few exciting events. We will be holding our next in-person event in April at the new medical school location in St. Cloud, which is really exciting to see their space and hear about the work they are doing to build the rural health healthcare workforce here in Minnesota. Our next virtual event will be taking place in February, and we'll feature the Clinical and Research Support Center, and their staff will be sharing resources that they have around doing rural research, and not just even clinical research. They have resources around program evaluation and other kinds of rural relevant work. So that should be a really great learning opportunity to know more about the resources that they offer. So if you are interested in joining the collective, you can either send me an email, which my email will be listed at the end of this presentation, or you can also complete a membership form that's also available on our website. And if you are interested in learning about what the members of the Rural Collective have benefited from and gained throughout their participation in this group, I'll direct you to a journal article about the Rural Collective that was published in the Journal of Health Promotion and Practice My colleagues and I outlined the model of the collective and shared some survey data that we collected last year from members of the collective about their experiences in the group. And so their responses were really overwhelmingly positive, and people really found that their membership in the collective was beneficial to their rural work because it's increased opportunities for networking and collaboration, and it's just provided greater awareness and understanding about the scope of rural work happening across the university system. So again, if you're interested in joining the collective, please send me an email or fill out a membership form on our website. And so finally here, I'll share about Project REACH, which stands for Rural Experts Advancing Community Health. And like I mentioned before, this is our community-based program. So Project REACH is a year-long health policy and leadership training program for community leaders in rural Minnesota. And so when we say community leaders, really mean, we're very vague in this because it's really anyone who's living or working in a rural community who really wants to make a difference in their community through policy change. And so Project REACH participants learn to frame health policy challenges in their rural Minnesota communities and how to communicate effectively with state legislators and other policymakers. There's no cost to participate in the program, and participants are also given a $1,200 stipend for their time and effort because we want to be able to compensate people for the incredible amount of time that it takes to be able to engage in policy work. And so over the course of the program, participants choose a health policy issue that's specific to their rural Minnesota community, and they learn how to appropriately define the problem, how to use research and data to support the problem, learn about different levels of government so they can determine, what entity has decision-making power over that particular issue. They learn how to engage with key community partners who are impacted by this issue in their area. And ultimately, they write a policy proposal and create other supporting documents that they can then share with their local, state, and federal policymakers and other community stakeholders. And so participants are also paired with 2 university-based learning partners who provide technical assistance to support throughout the course of the program. And this academic community partnership model has really demonstrated to be a very impactful opportunity to create policy change in rural Minnesota. Participants living in rural communities, they provide expertise in the needs, the strengths of their communities, and then the university learning partners bring expertise in health policy, civic engagement, and subject matter expertise related to participants' community policy problems. And so this knowledge sharing between community and university partners has really influenced change in rural Minnesota and has really made a positive impact on how university partners engage with rural Minnesota stakeholders in their policy work and research. So we've had 13 participants across 4 cohorts of the program. They've successfully completed the program, and we currently have 5 individuals in our current cohort that began the program this past August. So I have a really fun map here highlighting our participants across the last 5 cohorts and the different communities across the state where they live or work. And so as you can see, most of our, we're working with people all over the state, which is really great. Most of our participants have had either some sort of background in healthcare or such as being like a public health educator, a pharmacist, a nurse. We've had a few community health workers, but we've also had people who don't have public health backgrounds go through the program as well, such as like a farmer, a nonprofit executive director, an engineer, a teacher. And so I'll give a quick overview of some of the policy topics people have worked to address over the last few years. Social isolation amongst older adults in the Iron Range area, suicidal ideation amongst, high school girls in, Chippewa County, access to maternal child health care for Indigenous women in Itasca County, high rates of childhood experiences in Brown County, type 2 diabetes in low-income residents of Coochin County, hospitalization and mortality amongst dialysis patients in northern St. Louis County, things like that. There's a wide variety of topics. And again, it's very organic and specific to the rural Minnesota communities where people are coming from. And it's very meaningful for each of the participants. And so I want to just provide like one in-depth example about the work and impacts of one of our most recent Project Reach alumni. So Dan Wilson is a farmer in Winona County in Southeast Minnesota. His work in the program has focused on nitrate contamination in private wells in Southeast Minnesota. And so as a farmer, that's, an issue that he was very aware of going into this program. And so his policy solutions have focused on utilizing community health workers to do well testing and provide health education on the impacts of nitrate contamination and to provide resources regarding mitigation. And so last year, he met with a wide number of stakeholders and policymakers on this issue, including leaders at the Minnesota Department of Health, Minnesota Farm Bureau, county commissioners in Winona County, the Extension, Well Stewards Program, and policymakers at the state, including Representative Christy Purcell, who is the vice chair of the Environmental and Natural Resources Finance and Policy Committee. And so his advocacy has really led to a commitment to allocate funding towards utilizing community health workers to do this testing and education through the Tap-In program, which is an initiative funded by the Minnesota Department of Health that focuses on clean drinking water in Southeast Minnesota. Dan has presented his policy work at the Southeast Health Equity Network through MDH. He's also published an op-ed about this topic in MinPost. I have like a little screenshot of that article here. And when he wrapped up the Project Reach program, he joined his local comprehensive planning committee to ensure that this policy work related to reducing nitrate contamination continues. I know he was also selected to participate in the Cancer Advocates program through the Masonic Cancer Center here at the U in order to continue to build his advocacy and leadership skills to make a positive impact in his community. But over the summer, he also announced that he's now running for the Minnesota House of Representatives in his district in the Winona area. And he recently shared with me that his participation in Project Reach has allowed him to continue to raise this issue of nitrate contamination in his campaign in a way that's given him credibility in a way that wouldn't have been possible without Project Reach. And so as I wrap up here, I know we only have a few minutes left. I wanted to share some thoughts about the program that were shared by participants in either their final program evaluations or their program exit interviews. So one person here says, through my participation in Project Reach, I had the opportunity to sit down with our city manager and chief of police. While the meeting was on youth mental health, we engaged in other health topics and unveiled several potential collaborations to improve health and safety in our community. I remember leaving this particular meeting with hope and excitement for my community. And so I feel like this shows that this program has given people an opportunity to build more relationships and partnerships within their community, which is really great. Another person said, the most valuable thing I learned was the intersection of academia and public health in the field. There are a lot of untapped resources at the University of Minnesota. Similarly, another person mentioned what helped was meeting with my learning partners to throw around ideas and to ask questions for them to confirm certain things. When I had doubts, it was just it's been a beautiful process. I think this really shows how the program is really getting rural leaders access to resources and supports here at the university that they may not normally have access to, and how this partnership between university faculty and staff and rural community leaders has been, again, just such a positive exchange of knowledge and learning. And then finally, here someone said, I collaborated with other dialysis centers in our county to gather information and discuss transportation difficulties and obstacles that our patients face and how we can help them. This has opened up the door to transportation as a bigger area-wide issue instead of an issue for each individual dialysis center. And I really love this. because it really shows how the collaborations and discussions and the policy work that people are doing is really focused on benefiting the health and well-being of rural Minnesotans in such meaningful ways. And so before wrap things up and hand things back over to Guillermo, I do want to share that we'll start recruitment for our next Project Reach cohort in January. The application process is a two-step process. We really need people to complete an interest form by the beginning of March. And this interest form is really just is a screener for eligibility for the program. And then eligible applicants will get the application that will be due in April. Our next cohort then starts in August of 2026. So if you know someone in rural Minnesota who would be interested in this program, please keep an eye out for the RFA and the interest form on our website in early January. We'll also share this information out on our Rural Health Program email newsletter that will go out at the beginning of the year as well. And another area to get involved is if you are a University of Minnesota faculty or staff member, is to be a learning partner. Our learning partners are faculty and staff members from across the entire university system who may be subject matter experts in health policy, maybe are subject matter experts in the particular health policy issue people are trying to address in their communities. Or maybe you are from rural Minnesota and are from some of the same communities as our participants. And so our learning partners provide technical and support and encouragement to participants as they engage in this policy work. And I've heard from our learning partners that they learn just as much from our participants as they do from them. So if you're interested in being a learning partner in the future and you're a U of M faculty or staff member, please reach out to me as well, and I'll get you added to my list of potential learning partners. So that's all I have here. Thank you again for having me. And I have my contact information here listed. So thank you.
Thank you, Katie. That's a lot of very, very useful information. And I just wanted to reassure everyone that the slides and also the key links of that Katie mentioned will be made available on the Breakfast Bite website. Feel free to post any questions you might have, but also you can contact Katie directly, and you see here the email address. I do have a quick question about the rural health collectives. So I know that Project Reach, you mentioned is strictly for Minnesota participants, but is the Rural Health Collective also working with the adjoining states? Some of our bordering areas also have interest, like in Wisconsin or in Iowa, etc. Is there any straddling across state lines?
Oh, that's a good question. I mean, for the work that people do, or any faculty or staff who are members of the collective who maybe their work overlaps like regionally, that's certainly the case, but I think everyone in the collective is a faculty or staff member at the University of Minnesota specifically. But like I said, most people probably do work in rural Minnesota, but other people do rural work that might be like regional or national in scope or even international. So anyone who is, affiliated with the university who's faculty or staff, or like I said, a PhD student whose dissertation has a rural focused question is welcome to join the collective.
That's fantastic. Again, I think we're reaching the end of our time, but this has been very, very interesting. And I just want to repeat that all this information will be available at a later time at the Breakfast Bites website, in which here we go. And thank you again so much for your presentation. And thank you all for joining us today. Have a wonderful day.